important to know your family medical history because many medical diseases and problems stem from genetic standpoints. So, for instance, cancers, breast cancer, colon cancer, diabetes, hypertension, hyperlipidemia, those things have a very strong genetic correlation to whether or not the patient will get that or develop that in their later ages as well. I think most people know the biggies, right? Like grandma died of a cancer, or I believe my mom was on blood pressure medication. But I don't think that most patients understand like age of diagnosis or what kind of cancer did grandma die of? What kind of treatment did she get to? Also, what was grandma's social history? A lot of people don't know whether grandma worked in a factory or did she smoke for most of her life. And so I would say that that's something that's limiting is that patients do know the big buckets of family history, but most people don't know the the things that we ask for, like age of diagnosis, what type of different cancer, what medications were they being treated on, how were they successful with those medications. And then also for those who do know their family and can talk to their family, I wouldn't add extra stress like keeping a binder, right? Just having, what we used to do as human beings is storytelling. Just making sure that the story is being told from generation to generation. Be inquisitive and say, hey, why was Uncle John hospitalized when he was 13 years old? You guys talked about it. What happened to him? Did he have a blood clot? So really just being inquisitive about those things. And we as providers should do a better job at arming our patients with the questions that they should be asking their family about the family history that matters. So, women who are having difficulties getting pregnant. Has anyone in your family had miscarriages? Do you have a family history of blood clots, people who have to be on blood thinners or thyroid disease? So really, based on what the patient is presenting with, arming our patients with the questions that they can go back and ask their family members. But I am not about adding additional stress like keeping a binder.